Welcome back to The Healthy Way. I am Dr. Stephan. Today we are talking about vitamin D. The real benefits, the right way to dose it, and the situations where you need to be careful. Vitamin D gets treated like a trend, but it is not a trend. It is one of the key signals your body uses to keep bones strong, keep muscles working, and keep your immune system communicating properly. It also plays a role in mood and energy, which is why people often notice they feel different when their levels change. I want to start with a simple truth. Vitamin D is not a magic shield. It will not fix every problem, and it is not the only missing piece in most people. But low vitamin D can quietly make a lot of things worse. Your body can be doing everything right. And if vitamin D is low, you may still feel run down, achy, and fragile in ways you cannot explain. The reason is that vitamin D is involved in calcium and phosphorus balance, and that affects your skeleton, your muscles, and even how your nerves fire. Now, let us address a big myth. Many people assume that if they live in a sunny place, they cannot be low. That is not always true. You can live in the sun and still have low vitamin D if you avoid midday sun, if you spend most of your day indoors, if you use strong sun protection all the time, if your skin produces less due to age, or if your body stores vitamin D differently due to weight. So I do not want you guessing. I want you making decisions based on your risk and, when appropriate, your lab results. In this video, I am going to guide you through what vitamin D does, how to think about sunlight versus food versus supplements, what a normal daily dose looks like for most adults, and when higher dosing should only happen with medical supervision. We will also cover contraindications and interactions that people almost never talk about. Before we begin, subscribe to The Healthy Way so you do not miss future episodes. Share this video with someone who is always tired, always achy, or worried about bone health. And comment below with one thing you want vitamin D to help with: mood, energy, immunity, bones, or muscle strength. Let us get into it. Now let us put everything into a practical routine that fits real life. If you are taking vitamin D, take it with a meal, preferably earlier in the day if you notice it affects your sleep. Some people feel more alert with it. Many people feel no difference at all. But taking it with food supports absorption, and that is the main reason I care about timing. Be careful with stacking. If you take a multivitamin, check how much vitamin D it already contains. If you also take a separate vitamin D supplement, add the amounts in your head. Then check fortified foods. The goal is not to accidentally push your total intake too high. If your goal is bone health, do not forget the basics. Resistance training signals bones to stay strong. Protein provides building blocks. Vitamin D supports the mineral side, but it cannot replace movement. If your goal is mood, go outside when you can, especially in the morning, because light exposure supports circadian rhythm and mood even beyond vitamin D if your goal is immunity. Sleep and nutrition still come first, and vitamin D is part of the foundation. Now I want to speak directly to the people who have pain, fatigue, or chronic symptoms and feel desperate. It is very tempting to take high doses because it feels like doing something. I understand that, but high dosing without supervision can backfire. The safer move is to test, correct, then maintain. If you cannot test right away, stay conservative with dosing and focus on consistency and food-based support. And here is another key. Vitamin D is not an emergency treatment for a bad day. It is a background nutrient. When it is right, you feel more stable over time. That is how you judge it. If you want, in the next video, we can talk about how to read supplement labels, how to understand micrograms versus international units, and how to avoid common dosing mistakes. Tell me in the comments if that would help you. Let us talk about what deficiency looks like and what blood levels mean in a practical way. Many people with low vitamin D have no obvious symptoms at first. That is part of why it is common. Over time, some people feel fatigue, low mood, muscle weakness, more aches than usual, or frequent illness. But those symptoms can overlap with dozens of other issues, so you cannot diagnose vitamin D deficiency by feeling alone. The blood test typically used is 25-hydroxyvitamin D. Many references describe a level of about 20 nanograms per milliliter or higher as adequate for most people for bone and overall health, and levels below about 12 nanograms per milliliter as too low. Very high levels can also be a problem, and levels above about 50 nanograms per milliliter are often considered higher than needed and may increase risk of harm depending on context. What I want you to hear is that more is not always better. People chase high numbers because they think it equals protection. That is not how biology works. Your goal is enough, not extreme. If your level is low, your clinician may recommend a higher dose for a short time to replete stores, then a lower maintenance dose afterward. That is often safer than taking a high dose forever. If you do not recheck, you can overshoot without knowing it. Also, vitamin D is not working alone. Magnesium is involved in vitamin D metabolism, and low magnesium can make it harder to normalize vitamin D function. Protein and overall nutrition matter. Sleep matters. Sunlight exposure affects circadian rhythm in addition to vitamin D. So if you correct vitamin D and nothing changes, that does not mean vitamin D was useless. It may mean the bigger picture still needs work. I also want to address people who cannot use sun exposure, like individuals with photosensitive conditions. You can still have a strong vitamin D plan through food and supplementation. The solution is not risk. The solution is a safer route with appropriate dosing and monitoring. Now we are going to talk about contradictions and cautions, because this is where people get hurt. Vitamin D is safe for most people at appropriate doses, but there are situations where supplementing without supervision is not wise. One major caution is hypercalcemia, meaning high blood calcium. Vitamin D increases calcium absorption. If your calcium is already high, taking vitamin D can worsen it. Another caution is a history of kidney stones, especially calcium stones. That does not mean you can never take vitamin D, but it means you should be thoughtful. Avoid high dosing and coordinate with your clinician. Hydration, overall calcium intake, and blood and urine labs can matter. Another group that needs caution is people with certain granulomatous diseases, like sarcoidosis, and in some cases, tuberculosis or certain lymphomas. In these conditions, the body can convert vitamin D into its active form more aggressively, which can raise calcium. That means even normal doses could potentially cause issues. If that is you, this is not a do-it-yourself supplement. Severe kidney disease also changes the vitamin D conversation because the kidney is involved in converting vitamin D into active forms, and some patients require specific forms of vitamin D under medical supervision. Pregnancy and breastfeeding are also times when you should not improvise high doses. Vitamin D is important, but dosing should fit your prenatal plan and your clinician guidance. Now, medications. Certain medications can interact with vitamin D or calcium balance. Thiazide diuretics can raise calcium, and combining them with high vitamin D can increase the risk of hypercalcemia. Digoxin is another medication where high calcium can increase risk, so vitamin D dosing should be cautious and supervised. Some medications reduce vitamin D absorption, like orlistat, and some bile acid sequestrants, which can make deficiency more likely and complicate dosing. The takeaway is simple. Vitamin D is a foundational nutrient, but the right dose depends on your body and your medical context. The safer you want to be, the more you should respect labs, risk factors, and interactions. Now we get into dosage, and I want to do this safely and clearly. For many adults, the recommended daily intake is in the hundreds of international units, not the thousands. For most people, ages 1 through 70, a common recommended daily amount is 600 international units. For adults over 70, it is commonly 800 international units. Some people do fine at those levels, especially if they also get some sun exposure and fortified foods. But here is where real life comes in. Many adults start supplementing because they already tested low. If you are correcting deficiency, the dose may be higher for a period of time, but that should be guided by your clinician and followed by a repeat blood test. The goal is not to megadose forever. The goal is to reach an adequate blood level and then maintain it. A practical, safe range that many clinicians use for maintenance in adults is often around 1,000 to 2,000 international units daily, especially in winter or in people at higher risk of low levels. Some people need more, particularly individuals with obesity, people with very limited sun exposure, or certain absorption problems. But once you start pushing higher, you should not be guessing. You should be monitoring. Now, let us talk about the upper limit. For most adults, a commonly cited safe upper limit is 4,000 international units per day from all sources, unless a clinician is using a higher dose temporarily to treat deficiency. That upper limit exists for a reason. Too much vitamin D can raise blood calcium and cause serious problems over time. So what is the best approach for you? If you have never tested and you are generally healthy, it may be reasonable to use a conservative maintenance dose and focus on consistency and taking it with food. If you have risk factors for deficiency or symptoms that could fit, or a condition affecting bones, it is reasonable to talk to your clinician about a blood test that measures 25-hydroxyvitamin D. And remember this: vitamin D is not a quick feel-it-tomorrow supplement. It can take weeks to months to rebuild levels. That is why the plan must be steady, not dramatic. Now let us get specific about benefits, starting with the most proven one: bone health. Vitamin D helps your gut absorb calcium and supports the normal process of mineralizing bone. If vitamin D is low, calcium absorption drops, and your body may pull calcium from bone to keep blood calcium stable. Over time, that can contribute to weaker bones. In adults, low vitamin D can be connected to osteomalacia, which is softer bone, and it can contribute to osteopenia and osteoporosis risk when combined with other factors like age, low activity, and hormonal changes. This matters even more as we get older. Around midlife, the body does not build bone the way it did as a teenager. If hormones decline with menopause or andropause, bone turnover shifts. Vitamin D becomes one of the basics you do not want missing. It is not the only piece. You still need protein, resistance training, and enough minerals, and you may need medical care depending on your risk. But vitamin D is a foundational piece for keeping bones resilient. The next benefit is muscle function. Vitamin D receptors exist in muscle tissue, and low vitamin D is linked with muscle weakness and higher risk of falls in some populations. Many people describe it as heavy legs, low strength, or feeling older than they are. Again, vitamin D is not the only cause, but it is one cause we can actually measure and correct. Then we get into immunity. Vitamin D influences immune signaling. People often interpret that as vitamin D prevents infections. The more accurate way to say it is that vitamin D supports normal immune function, and deficiency is associated with worse outcomes in some contexts. I do not want you thinking vitamin D replaces sleep, nutrition, or vaccines. It does not. It supports the system, but it does not replace the system. Now, let us talk mood. There is a reason people in darker months often struggle more, and vitamin D is one possible contributor, along with changes in routine, reduced outdoor time, and altered sleep. Low vitamin D has been associated with depressive symptoms in some studies, and correcting deficiency may improve mood for some people. The key word is some. If you have serious depression, you deserve full support, not just a supplement. So the benefits are real, but they are not a promise. They are a risk reducer and a foundation builder. When vitamin D is adequate, your body has one less problem to fight. Let us talk about where vitamin D comes from, because that changes how you approach dosage. Your body can make vitamin D in the skin when ultraviolet B light hits cholesterol in the skin and converts it into a precursor that becomes vitamin D. This is why people call it the sunshine vitamin. But the moment we say sunshine, people either panic or they get careless. The right approach is balanced. Sun exposure can help, but you still have to protect your skin, and not everyone can safely use sun as their main plan. Food is another source, but it is a limited source for most people. Vitamin D naturally shows up in fatty fish, egg yolks, and liver. Some foods are fortified with vitamin D, like certain milks, yogurts, cereals, and some plant milks, but the amount varies. That is why many people use supplements, especially in winter or if they have risk factors. Now, here is the key. Vitamin D is fat-soluble. That means it is absorbed better when you take it with a meal that contains some fat. If you take vitamin D on an empty stomach every morning with just coffee, do not be surprised if your blood level barely moves. This is also why people with fat malabsorption issues can struggle, such as certain digestive conditions or after certain weight loss surgeries. If that is you, dosing becomes more medical, and your clinician may need to monitor your levels more closely. You will hear about vitamin D2 and vitamin D3. Vitamin D3 is the form your skin makes, and it is commonly used in supplements. Vitamin D2 can also raise levels, but in many cases, D3 is preferred for maintaining blood levels. The main point is consistency and correct dosing. This is also where quality matters. Some people buy very high-dose products without realizing it, and they combine them with multivitamins and fortified foods. And suddenly, their intake is far higher than they think. Vitamin D is not like vitamin C, where you just pee out the extra. Because it is fat-soluble, excessive dosing can accumulate and become toxic over time. So the foundation is this. Think sources first, then think absorption. Then think dosage, and only then think about how long you should take it. Vitamin D is not a 2-week cleanse. It is a long-game nutrient, and the best results come when you treat it like a long game. Let us wrap this up with clarity. Vitamin D matters because it supports bone mineralization, muscle function, and normal immune signaling. And it can influence mood and energy, especially when you are deficient. You can get vitamin D from sunlight, from certain foods, and from supplements. But most people who supplement should think in terms of steady, appropriate dosing, not heroic dosing. For most adults, a common daily recommended amount is 600 international units, and for older adults, it is commonly 800. Many people use a modest daily supplement for maintenance, especially in winter or in higher-risk situations. A commonly cited upper limit for most adults is 4,000 international units per day from all sources, unless a clinician prescribes more temporarily to treat deficiency. If you are taking high doses long-term without monitoring, you are taking a risk you do not need. Contraindications matter. If you have high calcium, a history of certain kidney stones, sarcoidosis or similar granulomatous conditions, certain cancers like lymphoma or significant kidney disease, do not self-prescribe vitamin D. Coordinate with your clinician. Also be cautious with certain medications that affect calcium balance. Now, if you want a simple next step, it is this. Do not guess. If you have risk factors, talk to your clinician about a 25-hydroxyvitamin D test. If you supplement, take it with food. Keep the dose appropriate and recheck if you are correcting a deficiency. If this video helped you, subscribe to The Healthy Way. Share it with someone you care about, and comment below with your age range and your goal. Bones, mood, energy, or immunity. And I will tailor the next vitamin episode to what you actually need. Thank you for being here. I am Dr. Stephan, and I will see you in the next video.